Welcome back. There is concern over the polio virus resurfacing. A state of emergency, in fact, declared in New York this week after an unvaccinated man tested positive for polio, and then tracing found the virus in sewage systems there. Our Bill Folsom asked infectious disease experts locally if we should be concerned.
The polio virus resurfaces in New York. It has the attention of Dr. Michelle Barron, a director of infection prevention for UC Health.
It's more like, if we see this, would we recognize it? And do we have things in place to make sure that when it does come, if it ever came, that we're prepared to be able to manage it appropriately?
Polio hit the United States hard in the 1940s and 50s. The virus causes paralysis.
It can actually get to the point where people can't breathe.
With those cases, patients were put in a precursor of today's ventilator called an iron lung. Survivors often ended up with damage to muscles, causing lifelong disabilities. Then vaccines stopped the spread. It was considered eradicated by the late 70s.
Certainly in the 60s, 70s, probably into the 80s, it was just a common routine vaccination.
Immunization rates are still good, but now lower because laws allow for vaccine exemptions. The COVID pandemic brought more variables to vaccination rates. Some questioning the COVID vaccine started doubting other vaccines.
They're separate buckets. We have vaccines that we've been giving for 50 plus or longer with known safety records, and they're critical.
Another issue from the pandemic was people getting off track with healthcare maintenance.
During the pandemic, a lot of healthcare got delayed. Included in that is basic vaccinations, whether it's for school-aged children or for adults.
Barron says the simple solution for a serious disease is making sure you are vaccinated. In Colorado Springs, Bill Folsom, News 5.
Bill, thanks. By the way, the vaccination process for polio, typically a 4-dose series given either orally or with a shot. Well,